Hello, welcome to yet another video of Acharya Nidana Academy. So, in this particular channel, we are usually going to discuss about the concepts of Roga Nidana, that is what we say, the Ayurveda diagnostics. So, in this particular video, we are going to discuss about the application of physics, chemistry, and biology in terms of Ayurveda fundamentals. We are going to discuss these informations in the form of minimalism. What we are practicing so far. One small topic we are going to discuss from multiple angles. After that, we are going to discuss looking into the different patterns, what particular pattern is being followed in the body. So, in this particular regard, today we are going to discuss the concept of the Abhyantara Hetu. So far, we have discussed about the concepts of Bahya Hetu and its different classifications. From this video onwards, we are going to discuss the concept of Abhyantara Hetu, what actually that is being mentioned in the Urdhva Nidana. As such, the Abhyantara Hetu refers to the uh, the ones which are present inside the body, the factors which are present inside the body. So that means they are nothing but the dosha, dhatu, and mala. Dosha in the sense the vata, pitta, and kapha. Dhatu in the sense the seven dhatu are being mentioned in the Ayurveda. Rasa, Rakta, Mamsa, Medha, Asti, Majja, and Shukra. And Mala, that is Mudra, Purusha, and Sweda, etc. They are categorized as Abhyantara Hetu. So coming to the Urdhva Gati of these particular Hetu or the Dosha, they are considered as the upward movement. So here we are going to discuss what actually this particular Urdhva Gati refers to. In what way we are going to understand this particular fine. Okay. First of all, we need to know why we need to know about these different classifications. So whenever if you know about the exact classification, we can able to say exact site of the disease. In which particular part the disease is being or pathogens are being present or the vitiated dosha are being present, whether they are present in the alimentary canal, what is being considered as Abhyantara Roga Marga, or whether is it present in the intravascular compartment or interstitial compartment or intracellular compartment outside the bones and joints or marma, which is being considered as Bahya Roga Marga, or if the pathogens are being present in the intravascular compartment, interstitial compartment, and intracellular compartment inside the bones, joints, and marma. They are considered as Madhyama Roga Marga. So, for example, when a person is consuming the more amount of the food, it is considered as overeating. The term overeating, as per the Ayurveda, three different terms are there: Adhyashana, Atyashana, and Vishamashana. When you think about Adhyashana, where the person is consuming the food prior to the, what do you say, that the uh, digestion of previously ingested meal. So that means when a person is consuming the food in the stomach, that may be stored for a period of 2 hours. Within that particular 2 hours, if the person is consuming the food, that is being termed as adhyashana. Atyashana means wherein the person is consuming the too much amount of food at a particular time period. Ayurveda says when a person is consuming the food, two-thirds of the stomach capacity, the person has to consume the food. In case of Atyashana, the whole amount of the capacity of the stomach, the person is consuming the food. Sometimes the certain amount of the food that may be coming even beyond the stomach, sometimes that may come even into the esophagus also. So that's how the person may have the vomiting sensation at that particular time period. So that means in case of the particular stasis of the food, whether the person is having overeating, whether the person is having the storage of the food for longer amount of time, whether it is present in the stomach or small intestine, large intestine. So that we need to know about it. For that exact pathology, we need to know about the type of nidana that is going to be exposed to the human body, that has to be analyzed. Further, the number of pathogens in the sense. So, if the person is consuming more amount of the gobi Manchurian, what actually happens? Naturally, the person may have the inflammatory reaction that will happen in the stomach. So that means the stasis of the food that may remain in the stomach for even longer amount of time. Why that particular stasis that may happen? Because of the inflammatory reaction. The duodenum inhibits the movement of the food from the stomach to the duodenum. Hence, there will be the stasis of the food that may remain in the stomach itself, which is resulting in the reverse movement of this particular, what do you say, that the gobi Manchurian, spicy gobi Manchurian, etc. So the virulence of the pathogen, the third point. What do you mean by virulence of the pathogen? So that is depending upon the, let us take the example of gobi Manchurian itself. Less spicy and more spicy. Less spicy in the sense that can be attributable to the virulence of the pathogen is mild. More spicy refers to the virulence of the pathogen is very strong. In that particular situation, the person may have the pathologic events that can take place very rapidly in case of the very spicy gobi Manchurian, whereas the pathologic events that may be slower in case of less spicy gobi Manchurian. So, hence, the exact pathology that is occurring in the body that can be identified by one, that is the source of entry of the pathogen in the human body, number of pathogens entering into the human body, and virulence of the pathogen entering into the human body. To predict the prognosis of the disease process. So, if the pathogens are being present in the alimentary canal, based on the Ayurveda fundamentals, that can be eliminated from the alimentary canal itself. Why? That is asanna marga harana. That is elimination of the dosha or the pathogen through the nearest route. Whereas in case of the pathogens are being present in the intravascular compartment, that has to be brought into the alimentary canal, then that has to be eliminated either through the emesis or purgation or enema. If the pathogens are being present in the interstitial compartment, that has to be brought in the intravascular compartment, then that has to be brought into the alimentary canal, then that has to be eliminated via the oral route or rectal route, or either that is by the vamana or virechana or basti respectively. If the pathogens are being present in the intracellular compartment, then that has to be brought into the interstitial compartment, then that has to be brought into the intravascular compartment, then that has to be brought into the alimentary canal, then that has to be eliminated either through the vamana, virechana, or the basti. So if this is about if the pathogens are being present in the gastrointestinal tract, then that can be the prognosis of the disease can be good. If the pathogens are being present in the alimentary canal, intravascular compartment, interstitial compartment, and intracellular compartment, then that can be the prognosis of the disease that could be somewhat moderate. And if the pathogens are being present in the alimentary canal, intravascular compartment, interstitial compartment, and intracellular compartment inside the bones, joints, or the marma, in that particular situation, the pathogenesis or the prognosis of the disease could be poor. So, the planning the line of the treatment, that means that has to be whenever the pathogens are being present in the periphery. Say, for example, if they are present in the intracellular compartment, then that has to be brought into the interstitial compartment, then that has to be brought into the intravascular compartment, then that has to be brought into the alimentary canal. So, as we have discussed earlier, if the pathogens are being localized in the hand, for example, in that particular situation, what do you mean by asanna marga harana? So that means you have to make the rakta mokshana line of treatment. from that particular part, make a bloodletting either through the leech therapy or through any kind of the pricking, so that by the needle, so that the some amount of the what do you say, that the vitiated blood can be eliminated. In this way, we can plan the line of treatment there. To predict the progress of the treatment, in the sense, so if the person is suffering from, for example, the entry of molecules has been taken place. For example, 100 molecules of the pathogens are entered into the body, which are producing 100% of the symptoms. If you are giving the treatment, 30 molecules of the pathogens are being eliminated from the body. That means the person is showing 30% of improvement. All these can be decided by the nature of the presenting complaints, whether their severity is being decreased, in the sense that is showing the exact improvement in the treatment as such. So this is about the significance of knowing this Nidana. Why we need to know about this? Regarding the Abhyantara Hetu, so far we have discussed Abhyantara Hetu are being considered as Dosha, Dhatu or Mala. So here further some classification are being made. Urdhva, Adha and Tiryak Gati. That is three types of the Abhyantara Hetu. Three types are there, Vriddhi, Sthana and Kshaya. Three types are there, Shakha, Koshtha and Marmasti Sandhi. Three types are there, Chaya, Prakopa and Prashama. Two types, Sama and Nirama. Two types, Prakriti and Vikriti. And one type, that is Ashaya Bakarsha. So here we are going to discuss in this particular dish, today we are going to discuss Urdhva Gati. What do you mean by Urdhva Gati? As so, we are not going into the source of the entry, number of pathogens, virulence of the pathogens today. Now, as we have discussed the earlier in the video. So here we are going to discuss Urdhva Gati, what actually Urdhva Gati refers to. Suppose if the pathogens are being present in the large intestine, if the person is suppressing the urge of the defecation, so that is actually resulting in the reverse peristaltic movement later. In that particular sense, there will be the lack of movement in the large intestine, resulting in the lack of movement happen in the small intestine too. Later, the person may have the lack of movement in the stomach. So that means when the person is having the symptoms in the large intestine, so that means the suppressing the urge of defecation, etc. So that is resulting in the reverse movement of the dosha as such. This is what is termed as Urdhva Gati. Right? If the pathogens are present in the small intestine, not in the large intestine, in that particular sense, there will be the reverse peristaltic movement starts to happen in the small intestine, thereby which may lead to the lack of movement in the stomach. So then esophagus, then mouth as such. This is what we can say the Urdhva Gati as such. When you think about the pathogens are present only in the stomach, not in the small intestine, large intestine. So that is resulting in the reverse movement of the Vata dosha or the pathogens into the esophagus, then into the mouth as such. This is what we can say about Urdhva Gati. So that means depending upon the presenting complaint, we can able to predict Urdhva Gati also. So that means when the person is suppressing the urge of defecation, naturally the initiation of Urdhva Gati will be from large intestine. So suppose if the person is having pain in the umbilical region, not in the hypogastric region or in the sigmoid colon region, in the sense that pathogens or this Urdhva Gati is being started in the small intestine. If the person is doing the Adhyashana, etc., what we had discussed earlier, Adhyashana means, in that particular sense, the Urdhva Gati that can happen from the stomach onwards. So here the question arises. Suppose if the pathogens are being present only in the alimentary canal, can it be considered as Urdhva Gati? If that is happening, if the person is presented with either the nausea or vomiting, etc., etc., or if the person is having the skin lesions, in the hand or in the head, can it be considered as Urdhva Gati? The question is the Gati of the dosha that is being decided by the main criteria is alimentary canal. When the person is having the pathogens present in the stomach, then if they are responsible for the movement in the reverse peristaltic movement, that means in the esophagus or mouth, then we can say it is Urdhva Gati. If the person is having pathogens in this large intestine and if the person is suppressing the urge, then the pathogenesis that can be observed in the small intestine, stomach, esophagus, and mouth. This is also being termed as Urdhva Gati. If the person is having the pathogens are present in the small intestine, and there may be a possibility of the reverse peristaltic movement in the stomach, esophagus, and mouth, that can be termed as Urdhva Gati. That means if the person is having the pathogens either in the large intestine, which is leading to the reverse peristaltic movement, if the pathogens are present in the small intestine, that is resulting in the reverse peristaltic movement, if the pathogens are being present in the stomach, resulting in the reverse peristaltic movement, thereby the person may be presented with either the pain, the burning sensation in the gastrium, or the person is having the sore eructations or vomiting. All they are considered as Urdhva Gati. So, if now the question arises, if the person is having the lesions in the head, can it be termed as Urdhva Gati? No. Why? Because the pathogens from the stomach or small intestine or large intestine that will be moving into the intravascular compartment. Then it will be moving into the head region, leading to the pathogens, entry of the pathogens into the interstitial compartment of the head, then into the intracellular compartment of the head. That is not being termed as Urdhva Gati. That can be termed as Tiryak Gati, which are going to be discussed in the discussion of Tiryak Gati. Now, why we need to know about Urdhva Gati as such? If the pathogens are being present in the alimentary canal, that too in the stomach, then we have to make it eliminate it via mouth, either by the Vamana or Vemesis therapy. If the pathogens are being present in the small intestine and large intestine, we need to know about they are more towards the lower alimentary tract. Then in that particular situation, we have to eliminate it via Virechana or Basti. If the pathogens are present in the small intestine, administer Virechana, and if the pathogens are present in the large intestine, administer Basti or medicated enema therapy. So the take-home messages from today's discussion are Urdhva Gati is nothing but the movement of the pathogens from the alimentary canal, maybe in the large intestine, maybe in the small intestine, or maybe through the stomach into the upper alimentary canal. So that is termed as Urdhva Gati. If the movement of the pathogens are happening into the skin or head, this cannot be termed as Urdhva Gati. It can be termed as Tiryak Gati, which will be discussed in the discussion of Tiryak Gati concept. When the pathogens are present in the upward direction, then facilitate the movement of the pathogens in the upward direction. The only exception to this rule is management of Rakta Pitta or bleeding diathesis, where if the person is having the movement of the bleeding happening in the upward direction, maybe in the nose or maybe in the mouth, etc., then they facilitate the movement in the downward direction. So that means if there will be the lack of blood supply in the mouth or the nose, etc., thereby there will be reduction in the chances of bleeding through the nose or the mouth as such. So, dear ANA members, that's all for today. So, if you are getting some of the useful informations, then mention below what are the three major key takeaways from today's discussion. So, mention below what would be the one particular concept or video would you like to have in this particular channel. And if you are liking this particular video, then put a thumbs up and spread to the maximum number of true Ayurveda learners. That's all for today. Something more in the coming sessions of the video. Thank you.